Hello and welcome to my session, Building an Effective Track and Trace System for Guernsey. First of all, I'd like to thank the event sponsors, ScriptRunner, DQ Global, Proximo 3, Red Spire, Agilysys and Hitachi Solutions. Just to give a quick introduction to myself, my name's Mel Kingston. I've worked for Agilysys for about 7 years now. And I work in the CXM Customer Experience Management team. In CXM, we primarily are about building kind of customer-facing solutions for government. So we do all sorts of kind of benefits management, revenues management, anything that kind of involves customer interaction is our thing. Just to give you an overview of what I'll be talking about today, I'll be covering 4 main areas. So I'll give a bit of background and an introduction to Guernsey and how our partnership with Guernsey came about. I'll talk about the initial build that we built, the kind of core track and trace system that we developed for them almost a year ago now. Then I'll talk about how we added on the travel tracker to the track and trace solution, which supported the states when they wanted to reopen their borders and allow more people to travel back to the island. And then finally, I'll be talking about some very hot off the press functionality that we've delivered this week, actually, which is pivoting to the travel tracker to support more of the on-island self-testing. So to give a bit of background about Guernsey, Guernsey's in the Channel Islands, about 45 minutes flight from London. There's about 65,000 people that live on the island. Agilysys became the state's IT transformation partner around about 2 years ago, and we have been, a CXM team have been starting to build some new digital kind of customer facing forms. Dynamics is the core kind of CRM single version of the truth for all people on the island, and so that's kind of the core of everything that we do there. And we also build out kind of front facing with Drupal forms. This session is really about how the technology has supported the states to kind of support their track and trace and their COVID response. There's a really fantastic local public health team, so I'm not going to go into detail about kind of policy or their approach or anything like that. It's just purely around how the technology that we've built has supported the teams to get on and do their really important work. So just to give you a quick time overview. So there's 3 main elements to what we've built. There's the initial track and trace solution, which we launched around June last year. That took around 2 months, 6 to 8 weeks to build. And obviously there's been sort of smaller releases since the initial launch. So we are working on a, I guess, agile, kind of trying to release and iterate regularly, but obviously the most important thing was getting a working solution out there as quick as possible. In October, we launched the travel tracker. And again, that took around about 6 to 8 weeks to develop. And then more recently, we have been working on the self-testing. So we've pivoted to kind of the core technology of the travel tracker and made it available not just to travellers, but to people that are on island and need to book tests themselves as well. To give a bit of background about kind of Guernsey's response to COVID and how they've managed the pandemic, they didn't have a huge amount of cases, thankfully, and actually from, I think it was April last year, in the first wave, that was the last kind of positive case in the first wave. So from July last year, they were a little slice of normality, I guess. Everything was open. There's no social distancing, no masks. People back to normal if you lived on the island. The limits to that was obviously that the borders were closed, and so you were only allowed to travel either in or out for very specific reasons, so compassionate reasons, if you needed medical treatment, or critical workers obviously were able to come in, but it was very, very limited, the amount of people that were travelling, and that obviously wasn't ideal for people that live there, but also from an economic perspective for an island that relies so heavily on tourism. It was really impacting them whilst it was great to be able to keep the island COVID free, it was impacting their ability. It was impacting them economically. It's kind of missing such an important tourism season. So that's why the travel tracker came about in sort of latter part of last year. It was really about trying to find a phased way of, and a risk-based approach of allowing more people to travel to the island for holidays, but also obviously being able to manage and track and understand who's coming in and where the risk is, and making sure that people are isolating appropriately if they've travelled from areas that have high COVID rates and are therefore kind of considered more risky. So pretty much for the whole of last year, from July, things were, as I said, back to normal on the island, and the island was operating quite normally. When they launched the travel tracker in October, they did catch some more cases. So those more positive cases came towards the latter end of the year, but it was very clear and they could all be linked back to travellers. They'd all gone into isolation, so it was very kind of managed how still very managed how the island was managing the outbreak. And then sadly, in January, just a few weeks ago, they did have another outbreak that couldn't be traced back to travel. So and that actually quickly kind of the exponential rise of COVID quickly rise to quite a lot of cases. They actually found the cases in I think it was a Friday evening, and then by 12 o'clock the Saturday, the whole island was back in lockdown. So they definitely act quickly, and they are currently in lockdown again at the moment, although are actually starting their have started their phased exits again from the second lockdown this week as well. So that just gives a kind of overview of what's been going on in the background, and how the different kind of important kind of milestones of how we've hit different bits of the technology. So I'll start by talking a little bit about the initial solution that we built, and there were three main user groups for the initial solution. I guess the problem that they had was that spreadsheets weren't cutting it. They needed a more structured way of managing who was being tested, any contact tracing, and also managing kind of from a public health reporting perspective, numbers, and understanding cohorts, etc. So the three main user groups that used the initial build of the solution were the scheduling team, the kind of testing and resulting public health elements, and also the contact tracing team. So the scheduling team kind of does what it says on the tin. They're the ones that are booking people in to have their tests completed. Guernsey have an on-island drive-through testing centre at the hospital, and they also complete home visits as well. So the scheduling team was managing the slots at the drive-in centre, and managing the staff that go out to visit people and test them in their homes if they're not able to travel. And so obviously they book the patients in, and they also, when they arrive at the testing centre, they kind of mark them that they're here and arrived, which prints out the barcodes, which gets attached to the test tube. The testing and resulting, I guess, is the really meaty technology part of it, which is this way we've kind of had the seamless integration from someone taking a swab, attaching that barcode to the test. The sample goes off to the lab to be tested, and all in the background, the lab, the pathology system, and dynamics is being updated automatically. So people's results get pushed out automatically with really limited requirement for any kind of manual intervention. And I'll talk about that in a bit more detail. And then finally, the contact tracing element. So in the cases where a positive case is identified, the contact tracing team, a case is created straight away, and the contact tracing team gets work. And there's some structured forms that we've built which help collect information in a clear way, and obviously link the cases back to that primary, link any contacts back to that primary case. This is just a screenshot of what the schedule board looks like. It's pretty standard functionality. The states are fully in control. The scheduling team are in control of how many slots they make available and how long the clinics are. So if they kind of want to close early one day or need to have an evening session to accommodate additional testing, they just change the times and the spaces available each day. And then it's just a really simple drag and drop functionality where you select a free time, enter the patient details, and that links everything up. The different colour coding shows the different status of the patient, so whether they've booked, whether they've arrived, and you can also see if the result has come back in as well. So you can just check that everything is working as it should. Moving on to the testing part of it. So this is it's a really simplified diagram, I guess, and I'd be happy to talk about it in more detail if kind of outside of this, if people are interested in more kind of technical detail, but just to give you an overview of how it works. As a really high level approach, the flow diagram at the top there. So we've got the patient arrives at the drive-in centre. They're confirmed that they've arrived, which prints out a barcode, which then gets attached to the test tube of the sample of that person takes. They have their swab taken by the clinician, and sorry, I should have done this first. So yeah, when the patient arrives and the barcode is printed, actually that triggers the RPA agent. So we use RPA automation to link up the test result, the pathology lab system, and dynamics. So that's all done automatically. So patient arrives, they scan the barcode, that's the trigger for the RPA agent to then go and create a record for that person in the lab's pathology system. So that gets done, the person has their swab taken, the sample goes to the lab. The lab then scan the barcode, which is on the sample. So just like a normal kind of supermarket barcode, I guess. They scan the barcode, and the fact that the RP agent's created the record already, so that links up that sample to that person, we know who it belongs to. The pathology team then go on and complete the test. The result is reported back into the pathology system, and then that goes back into Dynamics. And then once the result comes back into Dynamics, we trigger the follow-on activities. So people can opt to have an SMS result if they're happy to do that and provide a mobile number. And for negative results, they can get that option. If it's a positive result, they always get a phone call, and that's how the local team wants to do it. So they have a team of callers who will get in touch if it's a positive, or also if you don't have a mobile phone or you want to have either way, you want your result phoned to you. So primarily that kind of cuts out a lot of the manpower needed to administer the test, where people are selecting SMS results. As soon as they've kind of had their test done, it's pretty much automatic process, which works nicely. The final element is the contact tracing team. So in the case of a positive, when a positive case is identified, the contact tracing starts immediately. So the result comes into Dynamics and a case is created against that person, that they're the primary case. And there are, I guess that's a standard approach for then collecting the ongoing information that's needed. So there's structured templates, very clear kind of ordered information of the information that needs to be collected around contacts. There's standardized drop downs, which helps with obviously reporting and making sure that there's a consistency across the way that the different contact tracers are working. We also have the World Health Organization template, and that is the kind of information that's required to be collected about contacts as well. And there's also the functionality in Dynamics to print off any official letters. So if someone is confirmed positive, they then have to isolate for 14 days and they get an official letter saying these are your requirements, and that's all done and managed. The tasks of printing the letters, making sure they're sent to the people is all also managed in Dynamics as soon as a positive case is resulted. So that's a really quick whistle-stop tour of the kind of core solution that we built for them, but it kind of moved them from spreadsheets and emails into a kind of structured way of reporting. And also automated the results, which from a time-saving perspective allowed them to work more efficiently through as many cases, through as many tests as they could. So that was all going great. As I mentioned, the island was kind of back to normal after July. Everyone was kind of operating normally, but it was really important for the states to be able to open the borders to allow people to travel. So part of the phased reopening plan was to allow people back to travel to the island, but they had to have strict self-isolation requirements, and the self-isolation requirements were associated with the countries that you've been to in the last week. So if you were from a kind of low risk country, then you didn't have to isolate. If you were from a higher risk country, then you did have to isolate. So we built the travel tracker and launched that in October, and this added 3 kind of new high level features, and that was that people were able to log in online and submit their travel plans. So this was the first customer facing data collection approach. It also allows people to complete a self swab on arrival. So part of the plans, the phased reopening plans, was allowing people to travel, but you could do a self swab on arrival, which again frees up capacity of the clinicians. So the clinicians were able to focus on people that were symptomatic or contacts of cases and were able to do that. But this added the extra capacity for lots of people coming in on a flight to be able to self-swab and get that surveillance testing in place. And then we also, so those are the kind of 2 customer facing elements that we use, and then we also added a new Power App to Dynamics, which was used by the border agency. So the border agency are they're responsible for managing and making sure people are in isolation. They also primarily make contact with people to check their welfare. If they're isolating, make sure they've got access to food, that they're doing okay, but obviously checking that they are adhering to the rules and requirements as well. The travel tracker follows the kind of same consistent look and feel as other solutions that we've built for the States. So the Guernsey green and the approach, that's a very kind of consistent official looking solution. So the travel tracker, so it's quite simple. You just need to register for an account with your details, and then you just submit a pre-travel form. The pre-travel form contains information, so when you're arriving and how long you plan to stay for, the method of transport, so if you're coming on, which flight you're coming on, which boat you're coming on, if you're coming by private flight or private boat. It also provides that option to book a test. And you can also add children. So if you're a family traveling together, you can add children. Children over the age of 14 are tested. So you could also opt in to have them tested as well if you wanted to. I mentioned that the self-isolation was dependent on kind of the risk of the country that you'd been to. So we built a lot of logic into the travel tracker. Countries were categorized 1 to 4. So a category 1 country was kind of very low or no COVID at all. So associated with that was no isolation requirements. As you move through the higher prevalence rates up to category 4, you had more stringent requirements. So if you were from a category 4 country, you had a mandatory isolation period of 14 days, and that was non-negotiable. You were offered to take a test, because obviously that's useful from a public health perspective. You might want to know yourself if you've got COVID, but it's also useful to know, if you've travelled on a plane, they can then contact trace the rest of the people that were in close proximity. So everybody was offered. Tests weren't mandatory, but what it did do is, if, for example, you were in a category 2 or category 3 country, it gave you the opportunity to be released from your isolation early if you got a negative text. One of the real benefits of the system and building kind of dynamics in this way is that it allowed people to have the flexibility. So the states could change the country categories quite easily, and that applied the different rules rules for each person. So it's a really easy way of them to manage the different approach and the different policy based, as you know, things are changing quickly at that time. They still are changing quickly, but it allowed them the flexibility to adapt as kind of policy and politicians change the approach. So once the people have submitted the pre-travel form, that obviously is collected in Dynamics, collected against the person record. And then the next thing they need to do is just when they arrive at the airport or at the port, or however they get to the island, they need to log back into the travel tracker and just either confirm that they've arrived if they're not having a test, or go through the testing process if they're having a test. So if you're not having a test, it's a really quick process. You literally just log in and say, tick, yes, I have arrived. That lets the system know that you've arrived, lets the border agency know, and that just means that that we know exactly who's on the island when. However, if you're having a test, you get shown to the new testing facility. So this picture here is actually the arrivals hall of the airport in Guernsey, or what used to be the arrivals hall. And it's now been changed into a testing facility. You can see there's lots of booths there, kind of three-sided booths, one open, the open front, and that's because it's a supervised self-test. People are on hand to help. They're kind of checking to make sure you know, you're basically doing the right thing, you're not doing anything silly, and that tests won't be spoilt. So if you're having a test, you get shown to this facility, you log back into the travel tracker. You get provided the sample collection kit, so that'll have the sample swab and a test tube. Obviously, you do the test yourself, up the nose and in the mouth, secure the sample and put it into the sample bag, and then you just scan the barcode that's on the test. That links, so we know that test belongs to you as the person. And then the traveller just needs to drop the completed test, all secured, into the deposit box before they leave the airport. That then goes off to the lab to be processed. And in the same way that we use the RPA agent to create the record in the pathology system, we do the same here. So as soon as the barcode's scanned, the RPA agent creates the record in the pathology system. So by the time that the test actually arrives at the lab, we know, and the barcode gets scanned, we know who that belongs to, and we know that the result can go out automatically. So the resulting works in exactly the same way as it does in phase one. Actually, it's really impressive turnaround times on this. So if you landed in the morning, most people were getting their result that evening, and majority of them were within 24 hours, sometimes 48 hours in exceptional circumstances, but a really impressive, really kind of slick turnaround time from the whole process of the kind of infrastructure, the labs team, getting quick results to people. And then finally, I'll just talk about the border agency element of the track and trace app. So we added a new Power App which was specific to the border agency to access. That gave them access to the information about that they'd submitted in their pre-travel form. So how long they're staying for, what countries they'd been to, whether or not they were taking a test. I won't go into too much detail for obvious reasons. I won't give away their kind of enforcement secrets, but it's a way of them managing kind of who they want to call, who they want to visit, and case management of making sure that people are contacted. Primarily, they are there to contact people to do welfare checks, to make sure that the people are okay, that are isolating, that they have access to everything that they need. But they are obviously also checking that people are doing what they're supposed to be doing, and do act accordingly if not. And again, another example of kind of decisive action. They have £10,000 fines for people that are caught breaching. So they don't mess around. They act swiftly, and they make it clear that people have to stick to the rules. One of the things, actually, before I go on to this last bit, another thing that's been really important in the system, obviously, is because we've got the different users. We've got public health using it, we've got the border agency, we've got the scheduling team. The security roles and the way that the system's separated is obviously really important. So the public health information, the contact tracing information is kept very much private and separate on a need-to-know basis. The border agency don't have access to the information that they need, and that's something that's really important to be able to kind of protect the confidentiality and the integrity of the data and the system. So very much role-based access on a need-to-know basis. So finally, we're moving on to the last part, and this has all happened fairly recently, but it just goes to show the flexibility in the system that had been built. So Travel Tracker was working fine. People were travelling back to the island, and then obviously the rates kind of end of last year, around Christmas time, the rates everywhere were getting higher. So sadly, that meant there was another outbreak of COVID on the island in early January. The outbreak was identified in, like I said, the Friday night, and by midday the next day, the whole island was back in lockdown. So another example of really decisive action. But what that meant was, obviously, there was a significantly increased testing. There was a requirement for testing kind of symptomatic people, contacts of cases, and also the essential workers, so people, law enforcement, police officers, people that were working in shops, people that were doing deliveries, who weren't able to work from home, weren't able to stay at home, were doing the essential work, keeping the island going. There was just a hugely increased capacity to do the tests, and the actual infrastructure of the island didn't lend itself well to be able to do lots and lots of drive-through tests. So we pivoted the travel tracker to actually do local testing for people that lived on the island, and this is actually being pivoted for essential workers. So in the same way that you kind of you do a self-swab yourself, the local testing, so the essential workers are going through, they have a kind of regular testing regime where they self-test and get the results in the same way. And what this allowed us to do was actually really quickly respond. The travel tracker functionality was already there and working, and by kind of moving some of the self-test, the essential workers being able to self-test meant that the capacity was protected for people that needed the clinician swab. So people that had symptoms, people that were contacts of cases were able to go and have a clinician swab. And then people that were just being tested as a more kind of surveillance approach, just making sure that if you're out and about that you're not kind of inadvertently spreading the virus, that they were able to utilise the travel tracker element. So that's a really whistle-stop tour of what we've built. I hope you found that interesting. I've just got a few kind of takeaways, I guess, that of how it's worked and how using the dynamics technology has really just enabled us to provide a really kind of robust solution for the States. So the first thing I've been reflecting on is the pace at which we've been able to deploy this. So both the kind of first core build and the travel tracker took, I think, about 8 weeks to build. We've obviously iterated since we've got that kind of MVP version out there and added additional functionality, but actually as getting a core system that does the job, gives them a robust way of tracking who they've got, what the test results are. The ability to do that was really powerful. Coupled in with that, the flexibility. So COVID has, the policy changes. It is a kind of ever-changing requirements, ever-changing policy as kind of more is learned, as rates change around the world. And so this is probably the most flexible project we've ever had to do. And at no point have we had to kind of go back to the drawing board and start again. We've been able to adapt and build on what was already what was already there. So the flexibility in the system and the ability to respond really quickly to last minute changes of policy has been really, really key, and has meant we've been able to keep up with the pace of change. The ability to manage the cohorts of people is also really powerful. So, you know, if it's a border agency, I can see everybody that was isolating. Now, if I'm a kind of public health worker, I can see the different cohorts of people. I can easily track, you know, places that they've been to or people that they've been in contact with. You've just got that kind of really clear single version of the truth, ability to kind of report and find out the information that's really important quickly. And then finally, the integration element of it, and we do use RPA to automate with pathology system, but actually that's provided a really seamless approach, and just the ability to do that has really speeded up the process. It's a really efficient process, so people are only involved when they really need to be, which means that the, you know, staff that are incredibly busy doing really important stuff are free to do that important stuff without getting distracted by admin functions that can be automated, really. So yeah, they're my learnings, I guess, or my reflections of how we've built. And who knows what this will go on to do. Nobody really knows what's around the corner with this virus. But hopefully, if any other elements are needed, we've got a flexible system that can again be built upon to support whatever comes next. Thank you for your time. Thank you for joining this session. I hope you found it interesting. I'd be really keen to continue the conversation. Please do get in touch via company LinkedIn or me personally. If you've got any comments, I'd be really happy to hear them and happy to chat more about it. Thank you.